It's 4 o'clock on Tuesday, the 25th of October, here for the Sioux Falls City Council information meeting. Again, thank you all for being here, and for those that are watching us on TV or some other means of education, if you will. We'll get right into our agenda and ask, I believe, Councilor Kiley for a report on the Land Use Committee meeting of October 17th.
Thank you, Mr. Chair. We had one item of discussion, and that was proposed changes to private best management practices, or BMP ordinances. Lance Weatherly gave a good presentation. Principal engineer led the discussion on amending a section of the ordinance which pertains to privately owned best management practices. He provided a brief overview of BMPs, which included what is a BMP, the different types, and why there is a need for the ordinance. And the proposed ordinance was vetted through IRAB and the Home Builders Association. And Mr. Weatherly also said this ordinance is a continuation of the city's effort to promote water quality in the Big Sioux River and to help educate owners to be proactive in the operations of privately owned BMPs. He added that a number of BMPs are approaching a decade, and they want to get in front of helping the facility operators maintain them. And some discussion followed. We had no open discussion and adjourned 25 minutes later.
Questions for Councilor Kiley? I have one for our listening and audience in the right here. Would you explain what a BMT is?
Well, it's actually a means of controlling water on properties, both public and private. And it's not just meant to be a holding pond, but as it does operate in that way, but it also helps to filter the waters and make sure that the waters are clean before entering the Big Sioux River again.
So it's the detention ponds, if you will, around the city that are developed by the city and or the contractors or the developers so that water can be
exactly, and it helps in addition to cleansing the water before it enters the river, it also prevents water from spilling over onto private properties and causing other issues.
Super, thank you very much. Okay, let's move into our presentations then. Tobacco-free ordinance. Mary, or I'm sorry, we got open discussion. I'm sorry. Yes, Councilor Starr.
Thank you, Mr. Chairman. There were a couple of things this week that I was privileged to be part of, and I wanted to share them with the rest of the council. The first item was I was able to do a welcome to Sioux Falls for the District Toastmasters group that met this weekend at the Downtown Holiday Inn. There were people from North and South Dakota, Minnesota, and parts of Montana, and they were very happy to count how many ums and ahs that I had as part of the process. So, but I did bring out my own evaluator and grammarian with me, my daughter, and she was supposed to count, but she said I did okay by the time we were done. I encouraged them to spend some money while they were in Sioux Falls and enjoy our fine community. So. The other thing is that I was able to attend a neighborhood meeting with the Whittier Neighborhood Association. It's always good to be part of those groups and encourage them to be active in their neighborhoods and make Sioux Falls a better place. The third event that I was able to attend was an event that was sponsored by the ESC group, Establishing Sustainable Communities, and basically it was titled Being a Muslim in Sioux Falls. It was an awesome event, and I would encourage anyone to be part of their programs. They have several coming up shortly. Our own Assistant City Clerk Denise Tucker and Mark Blackburn were here before the council meeting last week to explain the event and tell us a little bit about it. But I'll bet there was over 100 people, and the room at the downtown library was full, and it was just awesome to get a chance to understand our Muslim brothers and sisters and what they believe and why it's different, why it's the same, and how active and involved they are in our community. So it was a great chance to represent the council and to be part of that. So thank you.
We thank you for that. Other input, Councilor Erickson.
Thank you. I just want to make a quick statement. I was not a part of I did not attend the ribbon cutting for the dog park, but as you know, a new one opened up on the west side of Sioux Falls, where we live, and we took our dog to. And it was so fun to be a fly on the wall and hear everyone talking about how amazing it is. when I was there was at least 15 dogs there. All behaving themselves, and the owners were behaving themselves as well. But it was really, really great to see how exciting such a small thing in our community and what a great quality of life it was for these pet owners. And so kudos to the Parks Department for getting this done and making it happen. And you really could hear a lot of great comments from the people in our community about how excited they were. So thank you for that.
Okay, now we can move on to presentations. Director Franken, you're on the agenda first, huh?
I believe I am.
Hey, you have the floor.
I'm going to kick this off, and I appreciate the reference to ums and ahs. I'm going to be internally thinking about that during my presentation here. So, Jill Franken, Public Health Director with the City of Sioux Falls, and thank you for taking the time this afternoon as we now move into the next layer of information sharing regarding tobacco policy that we're recommending to you as a City Council. We came last month to the Land Use Committee, and this is now our next step in the process to not only communicate further to you, but also to the community what we are recommending. So I've had the pleasure of serving on the steering committee with Parks and Recreation Director Don Kearney. We've been kind of co-chairs, if you will, of this project. And Mary Michaels from our health department, she is our public health prevention coordinator, has been our project sponsor. And then Deborah Gaikowski has been the all-important project manager, keeping us moving forward with this project. We've had representatives from our health department, from Parks and Recreation, from police department, as well as input from health organizations in the community also working on this project. So let's provide a little background, information about tobacco use and tobacco policies in our community currently. Tobacco use continues to be the #1 preventable cause of death. And after 50 years of evidence gathering, it is clear that it is a problem not only in our community but across the nation. There are devastating impacts of tobacco use. You know, think of the past days, and I referenced this a little bit in my last presentation, of when smoking was prevalent everywhere, when it was on airplanes, when it was in work sites where you had a partner, a coworker next to you smoking all day long. Maybe some of you obviously are young enough that you don't remember those days, but I remember going as a nurse. I remember as a nurse, before my shift would start, going into the little room after we'd get our shoes on and go sit in the room before we'd go into the peds unit, and we'd be waiting for our shift to start, and people would just be smoking like crazy. And I just think about those days, and I'm so grateful we don't have to be in those environments anymore, nor do we have to have that experience in our restaurants and in our bars, etc. So we are very fortunate that we know now the impacts of tobacco use, and we understand that any exposure is really hazardous to our health. So tobacco use was also identified as a health concern in our 2012 and 2016 community health needs assessments. To put some context around the tobacco use in our community, which I think is important to do at this time, our MSA average for smoking is 16.7%. That's the most recent number that we've been able to identify through the CDC. County Health Rankings is a report that comes out annually, and they look at us as a state and then identify rates of smoking for all of the counties in our state. Minnehaha County was identified in the most recent report at 17% and Lincoln County at 15%, hence sort of that 16.7 average that you might achieve in your MSA. Well, there are 43 counties that have a better rate of smoking or a lower rate of smoking than we do in Minnehaha County. There are 19 counties in the state that have a better or decreased rate of smoking than Lincoln County. For a city like ours that is progressive, I believe we can do better and should do better and should aim for better. So one way that we have done that, you and councils before you have actually addressed tobacco use. Some of you have been on the council, during this time, but certainly prior to this, there's been no smoking in city-owned buildings that has been adopted as policy, and then also the smoking around in restaurant, and I think that would be basically adopting the state smoking law. So we also know that it is the goal of my department to really promote even further tobacco reduction in our community. And so one way we've accomplished that was by working with Parks and Recreation on implementing a parks policy in 2013. And I would invite Don to come forward and talk a little bit more about that, please.
Thank you, Jill. Good afternoon, City Council members. Don Kearney with Parks and Recreation. As Jill mentioned, we did look at tobacco use in our community as well as what was happening in other communities, and we felt that we had an opportunity to impact the health of our kids through a parks policy that their Parks and Recreation Board approved. So what we did is we implemented a tobacco-free youth recreation policy that was adopted by the Parks and Recreation Board and then also endorsed by the Public Health Board in 2013. And really what that policy does is it regulates tobacco use on playgrounds within city parks and also in city parks where youth recreation activities take place. I can tell you that we've had great success with that policy, and it's really relied on self-compliance, signage, public awareness, and messaging for enforcement of that particular policy. In talking with our staff that work out in the field, as well as our Parks and Recreation, our park-assigned police department staff, there really haven't been any enforcement issues over the past 3 years. And in fact, we've received positive comments from parents, youth recreation directors, and visitors to the parks that were in support of the policy. It actually made their job easier, especially those youth recreation leagues that said, hey, we've told our coaches and parents that this is not permissible during our youth activity, such as junior football, and to have us do that as well, they were very appreciative of that. Since our last land use committee, the National Recreation and Parks Association released a statement regarding tobacco use in parks. They are really advocating prohibiting the use of tobacco products at all parks and recreation facilities in order to protect the health of parks workers, visitors to those parks, and the environment as well. They also did some polling around this particular question, and 4 or 5 Americans support eliminating use of tobacco in public parks and recreation centers. And so we're really excited about the National Association be supportive of this policy that we're trying to implement as well here in Sioux Falls. And as you know, the NRPA also is our accrediting agency through CAPRA, which is the Commission for the Accreditation of Parks and Recreation Agencies, which we are an accredited agency, one of only 1% of all parks and recreation agencies in the country. And so we're pleased that as a leading voice for our field of parks and recreation, that they've come forward with that position statement, but also done their national polling indicating the dangers of tobacco use and the need for communities to take steps to reduce tobacco use. Building on the positive momentum created with the current parks policy, we began to explore next steps in reducing tobacco use in the community and looking at what was both appropriate and within our authority as a city to focus on creating a healthy environment. So with that, I'd introduce Mary Michaels, who will provide additional information about the specific proposal we're bringing forward for your consideration today. Mary?
Good afternoon, councilors. Mary Michaels, Public Health Prevention Coordinator with the the Sioux Falls Health Department. I'm going to provide a little more information about why we are addressing tobacco use and then getting to some of the specific components that are part of this project. So as Jill mentioned, tobacco is still the #1 preventable cause of death in our country. And you can see on the slide, it's taking the lives of nearly 500,000 Americans every year. And even in our own state, smoking kills over 1,100 people. That's 3 of our South Dakotan neighbors every day. And so it is an issue that we need to address from a public health standpoint. But beyond the health cost, there are also economic costs. There are costs in terms of medical expenses. In South Dakota alone, $373 million. There are costs to employers in lost productivity. In South Dakota, that number is $233 million. And South Dakotans are paying through this their taxes. Smoking-related health expenditures have a tax burden on South Dakotan households of $587 every year. So there are health costs, there are monetary costs. And an important thing to remember about tobacco is we are talking about an addictive drug. Nicotine is an addictive drug. And just a couple of weeks ago, we spent a week talking about meth and the effect that meth has on the brain. Tobacco does the same thing, or nicotine does the same thing. And in fact, many people say that they have a harder time kicking the habit of using tobacco and nicotine than other drugs like cocaine and heroin. So it is an important public health issue that we need to address. And during that week, we showed that there are faces to this issue with meth, with other drug use, and with tobacco. There are changes on the inside of your body, there are changes to the outside of your body, and there are impacts on the people that you love. So I wanted to share some of that with you. The tobacco prevention saves lives, and we can't afford not to address it because the costs are too high. The use of tobacco takes years of life away, and it takes quality of life away. So these are real people who shared their stories to the Center for Disease Control's Tips from Former Smokers campaign. And they're from communities just like Sioux Falls. And there are people in our community that are dealing with these devastating effects of tobacco every day. And many of us probably know someone. So these individuals that are pictured are a 53-year-old woman who passed away right after she filmed her last ad, a 40-year-old man who lost his leg, a 35-year-old woman whose lung collapsed. The boy in the blue t-shirt is 16 years old, had a severe asthma attack triggered by secondhand smoke exposure and was hospitalized for 4 days. Grun von Behrens was a promising young baseball player, wanted to play for the Chicago Cubs, actually. He was using dip at 13, diagnosed with mouth cancer at 17, and died at 38. But before he died, he was a national spokesperson traveling the country talking about the dangers of smokeless tobacco, emphasizing that smokeless doesn't mean harmless, and that's why this policy looks at all forms of tobacco. Because holding an average sized dip holding an average sized dip in your mouth for 30 minutes is the equivalent of smoking 3 cigarettes. So to reduce tobacco use and keep people from starting, cities began to look at what could be done through a policy approach. And right now there are over 1,200 municipalities that do regulate tobacco in outdoor spaces, and this map shows both city and county locations where these policies have been implemented. In South Dakota, our state actually plays a large role in regulating tobacco indoors. We have a statewide Clean Indoor Air Act, which I should mention is enjoying tremendous support. If you remember 6 years ago, that passed with 65% of the vote. But in polling done in 2013 by the American Heart Association and American Cancer Society, that support had grown to 85%. So not only does the science support tobacco-free policies, people support these tobacco-free environments as well. But at the local level, we are able to regulate the use of tobacco on city property, and that's what we began to look at, talking with some of these other communities, looking at model policies, talking with them about what policies they have implemented, how it's working. Not only bigger cities that actually have more people and more facilities to regulate, like the New York, Chicago, Seattle, but also communities in our own area like Dickinson, North Dakota, West Des Moines, Rochester, Duluth, Helena, Montana, Lincoln, Nebraska. What's really important in all of this is that we try to use best practice and evidence-based information as we try to decide what was the best approach for Sioux Falls. So in our specific project, we really focused on trying to promote better health by preventing or reducing tobacco use within our community. We reviewed these other policies to ensure that we were defining the scope of our project, which was to extend the current tobacco-free youth recreation policy into an ordinance that would impact all city-owned property. And we have engaged many stakeholders in this process: health organizations, major event organizers that hold events in our park, and companies that manage our facilities like SMG. And again, reinforcing the implementation of this tobacco-free ordinance uses evidence-based information. So what is in the proposed ordinance? What we defined was the properties that would be included. So that is all city-owned property. That includes parks, including the right-of-way that is immediately adjacent to that city property, like the parking lots, the sidewalks, the golf courses, the event center, convention center, and arena. And we defined what we meant by tobacco products, that it would be any product made or derived from tobacco, so both the traditional cigars, cigarettes, pipe, as well as electronic devices, because use of those devices is an emerging public health issue. So as we talked with other communities, public and education awareness were really their primary tools that they were able to use in implementing and enforcing their policy. And just like our tobacco-free youth recreation policy, as Don mentioned, the signage, that public education and awareness has really been effective in enforcing that policy. When people are made aware of what the policy is, they are generally very respectful and abide by that policy. Voluntary compliance is typical, but because this is an ordinance, law enforcement would have that authority to issue a verbal warning or a citation. But again, that wouldn't be the primary vehicle. As we've seen in other communities around the country, that education and awareness is a key part of enforcing these policies. And we don't go about this work lightly. We really look at what's out there, what's best practice, what can we do to make an impact in the health of our community. So this type of policy does have many benefits, including the health benefits. But it creates that healthy environment that can support individuals who wish to quit or are trying to quit. And studies show that 70% of people who use tobacco do want to quit. When you remove that tobacco from the environment, you're supporting them, but you're also providing great role modeling for our youth. We know that if you can get somebody past the age of 19 and they haven't started using tobacco, chances are they won't. But nearly 9 of 10 smokers have tried that. They're smoking by the age of 18. Every day in the United States, almost 4,000 youth try their first cigarette. And 3 of 4 teens who think it'll be easy or think they will quit within a few years don't. In addition to those health environment or the health effects, we also are encouraging that culture of health and well-being. We are protecting our parks, our natural areas, our outdoor spaces with environmental protections. Cigarette butts are the #1 littered item in the world. They are a danger to small children and pets who might ingest them. If those butts make their way into waterways, they do leach toxins that can have dangerous effects to the water. So it is an environmental concern as well. But before I invite Jill to come back for some closing comments, I do just want to share a few headlines, and you have some in the handout that you received. But what I found interesting about this is all of these came out of studies that were released just this year. So from that first Surgeon General's report more than 50 years ago to today, science continues to show time and time again, no matter what form of tobacco we are talking about, there is no safe level of exposure or use for these products. As I stated before, we can't afford not to take action to reduce tobacco in our community, but the cost is simply too great. Thank you, and I'm going to invite Jill to come back.
Thank you, Mary.
Thank you, Mary. So next, what you'll see is the timeline that we're looking at for this project. We really are focusing now from now until the end of the year with certain activities that will be taken and bringing before you. So we would hope that our first council reading, City Council first reading would be November 1st, and that City Council second reading would be November 8th. And then before the end of the year, we'll be looking for, upon approval of ordinance or this policy, working on marketing materials, working with our partners, doing, starting an education campaign and getting ready for the spring. So as I mentioned, we've already talked with several groups and event organizers for such as Hot Harley Nights, Jazz Fest, as well as the sport leagues and SMG. I think I mentioned that a little bit last time we met with land use. We've also met with folks, the management group from the Event Center, Convention Center, the Arena, and the Orpheum Theater. We'll continue to work with these organizations as we work in the coming weeks. We have a lot of local support that we've already engaged, and that's one of the reasons our timeline has really been moved into that November time period. We're really pleased with the support we've had so far, and we've had a lot of great interactions and conversations with folks. Our Board of Health has supported this policy. They've approved it through resolution, and we have folks here from our Board of Health. We also have representative from our Parks and Recreation Board, and they also have endorsed this policy. As I mentioned before, Hot Harley Nights and Jazz Fest, we've met with them, and they're very supportive of this policy. I also want to mention that while I don't have it listed here, all the work we're doing is quite fluid, and I am aware just today that SMG was very willing for us to publicly say that they fully support this policy, and both SMG as far as their executive group and then their advisory board, and they would be happy to talk with any of you about this. And I also know that Tracy Turback is here, and he'd be happy to visit about any of the implications contractually related to the Convention Center, Event Center. So, and then we also have folks here from the American Cancer Society, and I believe, if I am correct, a letter was sent to you this afternoon from the ACS supporting this policy as well. And then we have folks from the American Heart Association here also. And then in addition, Health Connect, South Dakota, and the Sioux Empire Tobacco Free Coalition has also supported and endorsed this policy. So we also know that the Argus Leader Editorial Board has lent their support for this policy as well. And we've had several, we know of, residents who have provided letters to the editor conveying their support for the policy as well. So before I wrap up, there's just, I'm sure you have lots of questions, and I tried to anticipate perhaps just a couple that might be, you know, at the forefront of what you might be thinking about as you're listening to us bring forward this important policy. And one would be, how can this be enforced? By what means would we be able to enforce this policy? Well, we know that we legislate other public health and safety policy. In 2012, the City Council voted to ban texting while driving in Sioux Falls, and it was known that enforcement would be tricky and that it would take a lot of community education, which you've all been highly committed to engaging in and assuring that our community understands the dangers of texting and driving. But it didn't daunt you in considering passing that policy, and I would consider this just as important as a texting ban for our community. And I think we have the tools and the means to be able to educate the community and get great compliance with this policy. You know, specific to the golf courses, we've had some interactions. You know, I'm a golfer, and I hear my golfing folks talk about, you know, this policy, and they're asking me questions about it. You know, we've had great experience already in working in outdoor spaces, in helping to assure that there can be compliance with this policy. All of our recreation spaces where our little kiddos are playing every day right now are tobacco-free, and we've been able to achieve great compliance overall from the community, and we've had no enforcement issues in those areas. I would imagine that we can take those lessons learned very easily and apply those to the broader community where this policy would also be applicable. So another question that I'm sure you might be thinking of, won't this hurt the businesses of the managed facilities? So our facilities that we contract with folks to run on our behalf. Well, we do know that being tobacco-free is good for creating a vibrant community, a livable community, and for achieving a healthier workforce. A couple of things just to note. I think Deadwood Gaming, you know, they were surely very concerned with what would happen to their revenues when the tobacco policy was approved statewide and voted in statewide. But actually, just 2 years after that state law took effect, they had their best revenue year ever. And then also there was a study done in Florida where they found that the statewide smoke-free laws had no negative impact on sales and employment in the hotel, restaurant, and tourism industry. So I share this with you because how might this policy be applied to a couple of our areas in particular, like the Sheridan, for example, as well as the new golf course hotel. Well, you know, under the South Dakota's statewide clean indoor air law, hotels may still designate some rooms as smoking rooms, if you will, as long as those rooms are posted as such. But I am aware that the Sheraton Hotel has chosen to be completely smoke-free in their facility. So this would just apply now additionally to the outdoor spaces around the Sheraton. And I believe that the Sheraton general manager has stated publicly that he wouldn't expect this ban or this policy to hinder his business. I think he did indicate it would be a challenge to educate visitors on the city's smoking policy, but certainly that he would do so. And this is where we would come in as a health department and aid in that effort. I think the new hotel could also designate smoking rooms if they so choose. This ordinance would then just simply apply to the outdoor spaces around that on the Elmwood Golf Course hotel property. So how might it impact our contracts like with SMG, for example? Well, you already heard me say that SMG, who manages the Event Center, Orpheum, et cetera, that they are supportive of this policy. And whether it's those properties or Great Bear, the city does contract with businesses to actually operate those facilities on our behalf. So really they are an extension of the city in operating those facilities. So for those management, you know, those managed properties, this policy would require the property they work on to be tobacco-free. I mean, it is as simple as that. However, again, we have great experience with managing around tobacco-free spaces. And so I would say, you know, a place like, for example, Great Bear would be very similar to what we've done, you know, in our other spaces, in our parks facilities. And it would just be applying that additionally to Great Bear. So we know also that it is not uncommon for companies like SMG to already have experience in this space. They have shared with us that they're, you know, this is not unusual to have to comply with these kinds of tobacco policies in other communities where they have contracts and relationships. So as a reminder, tobacco prevention policies do result in many benefits to communities and to our residents. I do urge you to consider the community as a whole and the impact this policy will have on the health and well-being of our city. For these reasons, again, and this is to summarize what Mary already indicated, when you remove tobacco use from the environment, it does support those who have already quit using tobacco and those that are trying to quit. It also eliminates normalizing tobacco use and provides better role modeling for the youth in our community. And in addition to the health benefits, there are benefits to the physical environment, including the reduction of tobacco-related litter. So the stronger this legislation and this policy can be, the more likely it will be that young people will never start using tobacco. And those that are occasional tobacco users, it is very likely that they are going to decide, you know what, I'm going to quit. And then for those that are regular tobacco users, this could also be that time that they finally decide, you know what, I'm going to quit. So those are the reasons that we're bringing this policy forward to you. I hope this information, additional to what we shared at Land Use, has been helpful. And there are many of us here that are ready to answer any questions you might have. Thank you.
As we can tell, you're not passionate about this at all.
Not one bit. You would imagine I would be, right? Yes.
That's right, that's
Okay.
right. Do we have some questions from Councilor Neisert?
Director Frank, and I do have a number of questions. I'll just ask one for now, and I promise you this is not a gotcha question. I'm just trying to think of how this is going to...
I got to be ready for this one.
How this is really going to work in the real world.
Sure.
I want to take you back. About 10 years ago, I went to a concert at the Excel Energy Center. Mm-hmm. It was one of the most popular acts in the world at the time. It was a rock band, and the singer, and I thought this was insane, but the singer chain smoked the whole concert. I mean, he was just puffing and puffing away. I would just like to know, what would you expect SMG to do in that? And I'd see roadies doing it a lot too. They might step outside. I mean, mechanically, how is this going to work? Are they going to tell them not to do it? I mean...
Well, we already know that we have incidences where that occurs indoors And we have to work doing our best level effort to try and prevent that from occurring. I think you do education, you include it in contracts, you identify that we are a tobacco-free facility, not only inside but outside. But through this process of doing this work, I have heard stories about how, you know, acts are in the event center doing things like using tobacco inside already. And so I don't think that's a new problem. I think that's always a problem that we have to work through. So we would just continue to do our best, because every effort we make to uphold the policy and do this work will be that much more impact that it's going to have. But those are going to be things that we can't always control every single person, just like we can't control every single person to abide by the speed limit in our community, but we do our level best.
Okay.
Councilor Erickson.
I can get my microphone on. I have a couple different questions. One, with the SMG, if they're supporting it, why don't they just go ahead and do it right now? I mean, if they support it, just like guns, it's our facility, but we have a management facility, we have a management agreement with them, and so therefore they do regulate the gun bringing a weapon in or whatever. So if they do support it, why not already do it?
Well, you know, we've had actually pretty significant conversations with them, and I believe their intent was to bring back, when we first looked at opening the event center, not me, I shouldn't say that personally, I had nothing to do with that, other than supporting everybody who was heavily involved, but there was discussions around that. And so I don't know if Tracy, if there's anything that you want to add to that, as far as, certainly they could. But they also have indicated that they are supportive, and that has been on our kind of to-do list, is to come back around to them with conversation around that. So depending on where your decision lies with this, I'm sure we would engage again in conversation with them.
Because to me, if they can already do it, and one of the things is you can go into the concert, I give my ticket, I get wanded down, or you go through the metal detectors. I can then, and I'm a non-smoker, but I can then come out and smoke in a little designated area. You wipe that clean right there, that solves half the problem at the event center, if that's what they choose to do. And for me personally, I mean, we contract with them being the experts. And so if they want to do it, they can do it. They can do it at the zoo, they can do it at the Orpheum, they can do it at the Pavilion, they can do it at Great Bear, they can do it at all those places already, if that's the direction, I guess. My other question that I have is in regards to the litter. I understand. I mean, I am a property owner, and it drives me crazy when our guests smoke and litter on our property. But we do have a littering law in place already. So already, if you are flicking a cigarette butt out of your window, you can get pulled over for that if an officer physically sees you litter. Now, is that going to stop everything? No. And do I think that they need to spend a lot of resources on that? Probably not either. But it is there in place to already address the litter of it. My other question is, I don't know, it's more of a hypothetical, I guess, Director Franken. If you can tell me, I guess, with the conversations with this, the projected impact of tobacco-free. I mean, what is the goal? Obviously, to get people to not start smoking, to get cleaner air, all of those things. But is there a number, an impact? Is there some sort of attainable goal that you were looking at hopefully accomplishing with this?
Sure. You know, and that is the tricky business of public health, is really being able to, we have to have a lot of patience and a lot of stamina to be able to see the long-term impacts. And that's the work that we have to do in our community as the public health department, is to be able to say, we're going to stay on this and we're going to stay vigilant, so that in 5 years, in 10 years, in 15 years, we're able to see the benefits of this. We do have this in our plan through Live Well Sioux Falls to reduce tobacco use. Mary?
That's what I was just looking to see. We do have the number in the plan.
Yep.
I want to say it was at least 5% within our 5 years.
Yep, I think our plan was 5% reduction within 5 years. That's that's an ambitious goal.
Impressive.
And so and we are not going to be able to get there unless we take action and look at policies that can help impact that. And so, but one of the ways that we also can, and we probably haven't highlighted that enough, is the work that we'll continue to do with the Quit Line in really promoting that and really helping to support those efforts at the state level, so that we know we have as much resources in the community as possible. And then to go back to your the litter aspect. Certainly, since that still continues to be something that has done, even though we have laws that say we should not litter, this could certainly help improve that and impact that. And as Mary indicated, it is the #1 littered item in the world. So,
Councilor Starr.
Thank you, Mr. Chairman. Thank you, Director Franken. Public health advocacy is one of the most difficult things, and sometimes it's not the most popular thing with individuals and citizens. And I really appreciate you bringing you and your staff and the team that you've put together and the coalition of people who are supporting this. And it shows that you've really done your homework. You've anticipated the concerns, both from the council and some of the emails that I've received. I've had plenty on both sides of this issue, and it's definitely something that has sparked some interest in the community. So thank you for your hard work. I think one of the things that stood out to me during your presentation is that a patron could smoke in their hotel room, but they couldn't go outside to smoke. And that just points out the interesting part of the advocacy for public health. So that stood out to me. But in the big picture, what are you looking at for a budget or a fiscal impact, whether it's signage, marketing, if this ban would pass?
that's something we're working on right now. We're trying to get an idea from our partners in the city where we have city-owned properties to identify how much signage we're actually going to need. Some of it we know we simply have to replace or put a new face on our signage that's already in our parks, because we have quite a bit of signage already in our park system, and so that would be simply putting a new face on a certain segment of that. Then we also are working to identify where we might need, maybe not even an entire sign pole, but just be able to add a piece of sign, like a small piece perhaps of signage. So we're working on that right now, but we also know that we've got commitment from one of our organizations to help support the cost of that signage as well. So,
Good.
So we'll have more for you on that once we get a real number on that.
Perfect. Thank you again.
You bet.
Councilor Urbanbach.
Thank you. Thank you, Director Franken. This is, an interesting challenge for all of us. I did just a quick research on the number of Americans that smoke. It's about 1 in 5, according to. So about 20% of the population claim that they are smokers. In Sioux Falls, that's about 35,000 people that claim they're smokers right now, if we're the national average. So a small number compared to 173,000 population. So that's interesting to me. The other piece, though, that I wonder about is that idea of not only do we have concerns about enforcement inside public property and on public sidewalks at the parks. I think that slide kind of threw me a little bit. It's sidewalks that are attached to parks. It's not the sidewalk in front of my house. So just so don't email us about us banning smoking on sidewalks, please.
Right.
But my concern then is, because it happens with the major corporations in Sioux Falls, is when XYZ hospital or a nursing home or whoever bans smoking on their property, the smokers go across the street and make a huge mess on private property. How do we address that as a community? And have we thought about it that far down the road?
Well, I can address that a little bit, and Mary can come on up if she has some additional items to offer. The education is going to be the best way to approach that, and self-policing as well. Really, granted, somebody can go across the street and then it'll be perfectly legal for them to have a cigarette on the property that, on the sidewalk across the street. Certainly that is the case. That's already the case right now, that people can walk down a sidewalk and they're free to use, tobacco on those spaces currently. So I think education would be, and really working with our parks teams, especially since a lot of those properties might be park properties. And certainly, Don, if you want to add anything to this, but it would be really us doing an educational approach to make sure that our folks that use our parks are good neighbors and good stewards of the community around the park, to be paying attention to that. And if we have problems, we'll address those as they arise.
Okay. Councilor Neisert.
Could you clarify for me, kind of tagging off what Councilor Starr said, when I heard you talk about the Elmwood Golf Course, what would our policy with the Elmwood Hotel, what would the policy be there? Do we know what that would be?
Well, if this policy is approved, it would be inclusive of the space around the Elmwood Hotel. So that would be where we do have a little interesting, business that we have in Sioux Falls, where we have these two properties that are on, they're leased spaces and they run hotels. For every other hotel in town, it's not on city property, so this would only apply to those two hotels. And so certainly if they chose to have some smoking rooms, they could. They just wouldn't be able to smoke outside. They'd have to stay in their hotel room to smoke. Now, I don't know what their policy is as an entity, as a corporation, if they are a tobacco-free or a smoke-free facility from a corporate standpoint, but certainly that would be their purview. But if this policy is approved, that would include the outdoor space around the hotel on Elmwood Golf Course.
Well, and I think we've already done the contract, so maybe that can't be revisited easily, but wouldn't it be something to consider that, if it's your policy as a public health issue to just tell them if you're going to run a hotel on our property, it's going to be no smoking in any rooms as well? Doesn't that?
I think
maybe there's not yeah, please.
City Attorney Fifley is going to come on up.
Good afternoon, councilors. Dave Fifley with the City Attorney's Office. Councilor Neitzer, to answer your question, the last paragraph of this proposed ordinance says that this ordinance proposal would be cumulative of any current smoking laws regarding state law, Chapter 34-46 in particular. That has a section, I believe it's around dash 17 or 18, that talks about hotels can have smoking designated rooms. As an ordinance, we would not preempt, obviously, or create any preemption issues with state law. So we would view it as the Elmwood Hotel, since they are a hotel under state law, would have the option of either saying, we're going to designate smoking rooms or non-smoking rooms. It's a business choice for them. And we are not going to conflict with state law on that. However, the proposal would allow that the city could say the property, all the curtilage around that building would be smoke-free because it's technically city property.
Okay, so in lay terms, we don't have the legal power to preempt that section of state law.
Right.
So we couldn't ban it if we wanted to.
Right. And then to get back to some of the questions about the events center as well, that's an enclosed area under state law. They already have to be smoke-free under state law. And what I think people are missing, perhaps another requirement in state law, is that it actually says that the managers, operators of any public place, meaning an enclosed area, the statute says, shall inform their patrons about the Indoor Clean Air Act by the state of South Dakota. So all those obligations are already in place. So in terms of what the city proposal would be doing is a very small incremental step.
Thank you.
Thank you.
Councilor Staley.
For Director Franken, I've got four questions. First of all, a comment that I want to make is that I think it's wonderful that we have that youth recreation policy in place, and I'm 100% behind that with the playground and youth activities having no smoking there. I wanted to ask you, okay, first of all, what would a tobacco user do if they're at Jazz Fest? So where will they go to smoke? Second question is, if someone was on the bike trail, then how far would they go, or where would they go if they wanted to have a cigarette? Third question or a comment is, on a golf course situation, I would think the people in a golf course cart situation, they're going to be in closer proximity than just somebody randomly wandering through a park, right? We're talking about groups of people usually golf together. And then the last thing I wanted to ask is, if this thing is implemented and someone is given a ticket, how much will that ticket be?
Okay. I'm going to have Don come up first and answer those first three questions. Jazz Fest, bike trail, and...
Course proximity.
Yep.
Thank you, Don Kearney with Parks and Rec. As it relates to Jazz Fest, they would be required to leave city property, and so the reality is that if they choose to leave and actually use tobacco off of city property, and they could likely go to the nearest point where they're at in Yankton Trail Park, for example. And so within Yankton Trail Park, it would be prohibited. And so with that, they could walk across the street, for example, off city property. That would be their probably closest opportunity if they wanted to use tobacco. Or they could just, we would anticipate a lot of them would just say, hey, I'm going to wait till I get home, or I'm going to leave early, or whatever it might be. But they would be restricted within Yankton Trail Park where Jazz Fest is hosted. As it relates to the bike trail, the same would apply. While they're on the bike trail, as long as they were still on city property, which the bike trail is, if you're talking about the main trail loop, then they would be have to go again off of city property.
But does that go all the way down to they couldn't go down towards the river? That's all, that would all be, they'd have
Correct.
to get off to a residential street.
Yeah,
then.
and most of those are in city parks too, as you know, through Pasley Park and Yankton Trail, Spencer, Tomar. Those are all city property as well, and so they'd have to find a place off of city property. And then your third one was?
Well, the proximity and golf courses, I think you have people in groups more so than you would just randomly in a park too. Would that be an accurate observation?
Yeah, typically they
Looking there, they're actually, in a golf course, you're going to have more secondhand impact than you would passing someone by.
Yeah, most of the time it's foursomes or fivesomes. Most of the time, four people at a time. Doesn't mean you can't golf by yourself, but the majority of the time, from management of the tee sheet, we typically try to group people up.
Thank you.
You bet.
And then the ticket cost.
Good afternoon. Lieutenant Jeff Gardner, Sioux Falls Police Department. I'm the commander of our support services, which includes our parks. I visited with Keith Allenstein on this just day before yesterday, and this would fall under the current city ordinance of 10.999, and it would be $95. The actual fine itself would be $35, and the rest would be court and administrative fees.
Thank you.
Go ahead.
I have a follow-up.
Councilor Erickson.
So they'd have to come to court?
No, if they choose to. Everybody has the option to have their day in court.
Otherwise, they can just pay the fine and be
They can pay the fine,
done.
or they can go to court.
I thought I heard you wrong. I'm sorry. I was like, whoa, wait a minute here. Okay.
Councilor Erickson, or Erpenbach.
Thank you. I have a question for follow-up with Director Franken, please. You talked about SMG being fully in support. You haven't talked about pavilion management. What kind of reaction are they having? Because they'll have the same issue with sidewalks around the pavilion. And many people that go to the pavilion park in a city parking lot.
Correct.
We have brought this up with the director and management of the pavilion. They haven't taken a formal action, but their indication is that they would work with the city to fully support the policy. I don't have that in a formal resolution or anything, but we have had conversations with the pavilion as well. So they are aware of what this policy would mean for their facility.
Okay. Then I just wanted to comment on two things. One, that Director Franken said about the Deadwood, the threat in Deadwood when we as voters were making that choice about the indoor smoking ban. That was chosen by the voters of South Dakota. And the Deadwood gaming people were up in arms about it. And I just wanted to reiterate that that has not been proven to be an issue for them. The other thing, the other little bit that I read in terms of places with smoking bans tend to have lower rates of smokers. So if we talk about 20% of Americans saying that they're smokers, if we're going to put into place some sort of smoking ban in Sioux Falls, in addition to what's already here, we can very likely see reduced rates of smoking in general. So some real positive things can come out of this. We have to obviously think about it on a lot of levels. Councilor Starr indicated we're getting tons of email, but it's certainly something that we need to be a part of. So thank you. I appreciate it.
Thank you.
Okay, Councilor Kiley, we're going to have to cut this off pretty quick, but go ahead.
Thank you. And again, Director Franken, thank you very much for your efforts, because this is a proven issue. As you've stated numerous times, it's evidence-based data that's supporting your proposed ordinance. And it's probably safe to say that there's a number of us in here whose our lives or the lives of our family members have been impacted, and I can certainly say that is the case in my particular family with people very near and dear to me. So I do appreciate the efforts. I mean, close to 500,000 annual deaths, and I hate to even mention costs because that is so secondary to the health and to the actual death of an individual associated with that, and the impact that it would have on relatives and family and friends. The benefits of the policy, it seems to me, far outweigh any of the potential adverse issues that we might have to deal with, or some of the issues that have been pointed out. For instance, use that might be taking place indoors already, which is already covered. It's already not allowed, yet it's happening. And we're always going to have a few individuals that are going to violate policies and regulations and laws. I mean, it happens with our traffic laws. It happens with consumption. And I know that there's been some individuals have tried to relate this to consumption of alcohol. And I would just venture to say that my consumption of alcohol, while will affect if I'm over-consuming, it's going to be my liver, not yours. Obviously, if I'm over-consuming and operating a motor vehicle, that's a different issue, but we do have laws and regulations in place to hopefully take care of issues of that nature. And we do know that there's still countless violations that are taking place. But so I think that, you know, the benefits, as you mentioned, creating a healthy environment, supporting individuals trying to quit, and this is kind of piggybacks off what Councilor Erpenbach stated, that if we have the bans in place, it's more likely to see further reductions in the use. Reduces the exposure to youth, just a culture of good health. And we can say the same thing too about our diet. Obviously, there's those are personal choices that we all make, and sometimes it's not to have a healthy diet, but that is affecting us as an individual. Where the secondhand smoke, that does not discriminate against anybody, and I think that's why we are where we are here today. But the question that I really do have is, you know, we've talked about the effect that would have on managed properties and the existing hotel and the new hotel that's coming, and maybe the impact that it would have on our golf courses. Can you address, or could you address in the future, how other communities, because you stated in your presentation that more than 1,200 municipalities across the U.S. regulate tobacco use in areas that we're proposing, what their experience has been in managed properties similar to ours.
Sure. I think that maybe Mary might have a couple of examples that she can share. And then also we are continuously working to try and engage with other communities so we can get that information, you know, real examples of that to you. But Mary, do you want to just come forward?
And this is certainly something that we can follow up with more specifics, because some of our general conversations, we talked a lot about education, implementation, enforcement, what properties are included, and it's going to take a little more just to go back to our list of communities and find which ones have some managed facilities. But those do include facilities like golf courses, performance venues, sporting facilities. There are some communities, Boulder, Fort Collins, Colorado, that are more comprehensive because they have authority to go beyond just their city property, and they can regulate anything within city limits, and that does include some of the performing arts facilities, golf courses, but we can certainly get more information and bring that back about some very specific experiences they had.
Okay, thank you very much for your presentation. Is it the wish of the committee or the council that we bring this to follow the guidelines or the timetable that's on here? I understand, but I'm looking at not hearing any objections, so we'll get it on the agenda as we can.
Mr. Chair. Mr. Chair.
Yeah.
Just a question, just conversation, if I might, in terms of when the second reading is scheduled. This might be one, we have in the past spaced out the second reading rather than having it first reading and then a week later, second reading. This might be one, and I'll leave it up to leadership, but this might be one that we want 2 weeks between first and second reading, just to allow the public to kind of digest it. I don't know. I'm just throwing that out there for consideration.
I would just caution on that we will have a number of our members gone attending the National League of Cities event.
On the 15th.
And so we
I
want to
apologize.
avoid
You're
that
right.
particular date.
Right.
You're right. I
Already thought of
apologize.
that.
Yep.
So we could maybe go to the 8th and then go to the first week in December or something along those
Sure.
lines so that the whole council would be available. If,
Again, just up to you, up to the leadership.
Okay. Okay, thank you very much. Distracted driving. Galen.
Galen Smith, Assistant Chief of Police. I just wanted to give a kind of a wrap-up summary of our distracted driving campaign that the council had an initiative on for 2016. We all know, we all see it, driving, and maybe even some of us do it sometimes, is utilizing our cell phone when we're driving. Back about 10 years ago, I was a traffic sergeant, and we actually did some PSAs back then already about distracted driving. It wasn't specific to cell phones. But what we find is when you're driving 30 mile an hour in Sioux Falls and you look down for 3 seconds, no matter what you're doing, you're going to travel about 150 feet. And that's half of a city block. And there's a lot of things that can happen in a half of a city block. And that's at 30 mile an hour. So, of course, when you raise your speeds, you're going to travel further. And we've seen PSAs on TVs of all the dangers of that. So. In early 2016, after the City Council passed that distracted driving initiative, we met as a group, which consisted of myself, some folks from finance, City Council, Kylie and Erickson, to discuss how we're going to proceed with utilizing this campaign. And we all agreed that education was really the primary focus of this. So how are we going to do the education portion of it? And we utilized television, where we actually have 329 commercials that run some cable networks through the Sioux Falls area on some pretty visible channels. We put up 30 billboards that are still running now through the middle of November. And then we also utilized about 30 to 40 signs, which you've all seen in Sioux Falls, the no texting while driving, it's the law sign. I worked with Public Works people to determine the best locations for those signs. And then actually we contacted all the principals of the public high schools and the 2 private high schools and asked if they would be willing to put them on their private property, and all of them were fully on board with that too. As we know, we're trying to hit everybody, but the teenage crowd typically is very hooked to their cell phones and their electronic devices. We wanted to make sure that we hit that as well. So in addition to that, with the education piece out there, we also need to be aware that there's enforcement that takes place. So we scheduled 5 saturation patrols through our traffic section. And sitting in the back, in the middle there, is Sergeant Randy Brink. And Randy Brink is the sergeant of our traffic section, and he's really the boots on the ground type guy that supervises our traffic officers of all the complaints that you folks get on your emails about speeding, whatever the case is. I take those emails and I give them to Randy, who gives them to his officers to enforce them. And Councilor Staley, you're well aware, as in your budget presentation, you reflected some of that, of all the different complaint zones that we have. So we're very, very busy doing that. So his folks really were the boots on the ground officers utilizing the distracted driving campaign. So With that, we started with 2 saturations, the first one being in May and the first one in June, and the specific focus of that was education. So we would go out and stop people that were on their cell phones that we could determine were utilizing it in what we thought was transmitting, sending, or receiving an email, because that's the way the city ordinance is written. And we had these cards drafted up that give some statistics of the dangers of doing so, and every one of those people received that. They were giving verbal warnings or written warnings for those violations, and that's why you see the warning tickets were higher in the first 2 saturation patrols. In July, August, and September, we went out with the efforts of enforcing it, and we did that successfully. And if we scroll down, you'll see that our, if I can operate this here, we had over 200. Total citations issued were 289. Not all of those were the no texting. If we saw other violations or observed other violations, we're going to write them. But the total contacts and stops was 200 that we stopped for the texting. We wrote 64 tickets and several warning tickets. The interesting thing that I thought about this in talking to Randy Brink and his officers is that the feedback we received from the people that were stopped was overwhelmingly positive. We received very few negative feedback about it. In fact, people were, yep, I was doing it, I shouldn't have been doing it, thank you. People that got the tickets were actually okay with it. I've known of 2 that contested the tickets and went to court, and both were found guilty. So it's successful in how we're doing it. I'm not going to lie, it's still a very tricky ordinance to enforce. It's hard to do with one officer just doing it, because you have to really be able to establish the reasonable suspicion that they're using it to text. We started the first saturation by actually having an officer drive around and try to observe it, try to stop it or call it ahead. It was very difficult to operate that way. The place that we found to be the most successful was at 10th and Main, where we have a parking ramp. We have a spotter looking down into the vehicles that you can actually see very well what they're doing. And then they'd call it into an officer who's sitting a block ahead of time. It's a one-way street, so it's easy to manipulate, easy to get to. Some people say, well, isn't that entrapment? No, it's not entrapment, because we're not making somebody do something on their phone. We're just stopping the violations that we're seeing. I feel it's just a creative way for us to enforce the law, I guess. We did try it at 41 in Minnesota and 57 in Louise. Pretty limited success there, just because traffic is so congested at that time, in those places. You might observe the violations, but it's hard to get to. So moving forward, how are we going to address this with initiative complete, with the City Council approved funding? What we will do, Sergeant Brink advised that he will make efforts, maybe once a month, maybe twice a month, of having people that he has working that don't have other assignments going on, even if it's for an hour or 2 hours, taking those officers and doing similar projects once or twice a month for 2017 and the remainder of 2016. What we did find is in addition to the 64 tickets that we have, they have been proactive in doing it. We've written a total of 90 tickets this year for that violation, which is 3 times more than any year we've had in the past. So I want to thank the council for maybe pushing it forward a little bit, because I think it was a successful project. Are we going to stop it completely? No, we're not going to stop it completely, because people violate traffic laws all the time, but it's our job to educate and enforce as we can. So,
thank you, Galen. Questions, comments? Councilor Starr.
Thank you. Assistant Chief, thank you for your efforts and your department's efforts into looking into distracted driving and making it a priority. What I found interesting, a lot of times we hear people say, we don't like traffic enforcement. Don't you have something more important to do to catch real criminals? Or, we hear that, unfortunately. And when I look down at the list of statistics, when we were looking at warrants that were served as part of traffic enforcement, narcotics, I don't think there were any alcohol offenses, but some of the other things that happen as a natural part of traffic enforcement. One of the stories that always sticks out to me is that we all recall the Oklahoma City bomber, Timothy McVeigh, and he was caught in a routine traffic enforcement with a taillight that was out. So again, traffic enforcement is an important part of your job in protecting the city, and I am very thankful in this process of what we were doing as part of enforcing the distracted driving. So again, thank you.
Appreciate it. Thank you.
Councilor Kiley.
Thank you, Assistant Chief Schmidt. It is obviously a huge issue, distracted driving. It's just getting bigger and bigger. And as the prevalence of cell phones and other electronic devices or navigation devices that are built into automobiles are going to continue to distract us, especially at a time when our sole task should be the driving that's at hand. So we do appreciate you addressing the issue and appreciate the education versus enforcement aspect of it as well. I mean, that was the whole goal to begin with, was to not necessarily hit people over the head with a club, but to just educate them and let them know. And one of the best ways to do that is through enforcement. But as Councilor Starr mentioned and you has mentioned, it was good to hear that a lot of people were very good-natured about our efforts. And I'd like to thank all involved, starting with Councilor Erickson, because she allowed me to partner with her on this effort a year or so ago, and I greatly appreciate that, appreciate her effort, as well as your effort and the officers, all the officers involved, because this doesn't happen just starting with the council or one individual, but it took everybody working collectively and collaboratively together. And I'd also like to thank the South Dakota Office of Highway Safety for allowing us to use some of their ad campaign and actually putting our city tagline on that, as well as CityLink for producing ads that will, I will say, continue along with the production of the signs, which are permanently in place. We'll continue to reap benefits from the ads going forward, as well as the signage that's in place. And it's so again, it's been a collaborative effort, and I'd like to thank all of those individuals and organizations for their efforts. The funding, one quick question for you. We had allocated $50,000 for the campaign, and I know there was a point where we had used about 50% of that. Did we go beyond?
That was about where it ended.
About $25,000.
Yep.
And then we had considered going forward with a fall campaign, but we decided that we would do our part in trying to relieve the effects of our sales tax collections coming in a little bit lower than projected, and we decided that we'd allow the city to use that funding as they saw fit going forward. But I'm also encouraged by the fact that you will look into continuing this effort in the future. So again, thank you to you and all the officers involved. Thank you very much.
Yes, Councilor Erickson.
I'll just ditto what Councilor Kiley said. It was a great opportunity for us to work with your department, as well as getting other buy-in from council. To be able to see the impact of touches is really important to me, because it's those actual catching the offenders. And, one time we talked about, oh, let's do TV, let's do this, let's do this. But when it came to really touching the, offenders of who's doing the distracted driving, which looks like I know we talked strictly about texting, but it can be the dog on your lap, it can be your children, it can be changing the radio, it can be so many different things. And so I'm thankful for all that your department did. It was interesting. I did have some conversations with those that were involved. And, you know, it's just a great way to just be in the public, and you never know who's watching, so you never know. You shouldn't text and drive. You shouldn't be on your cell phone because you never know who's watching. And so it's a great educational component. And every day when I drive my kids to school, on the one road, I see this no texting and driving. And it's just a great reminder for not just texting, but the distractions of all driving. So thanks for your effort in this. It was great, and I hope that this is something that your department will continue to do in the future.
Absolutely.
So thank you.
Councilor Staley.
On a related but not exactly related issue, can you give me like a rough estimate of how many people you see talking on their cell phones? What percentage would you say people are actively using their phones? Like,
Yeah, and that's a rough deal, but anytime you're driving down the road and see somebody with something in their ear, it's got to be 1 in 2, 1 in 3, I would imagine. And that's just a guesstimate from what I'm seeing out there. But I was coming to work this morning and I was frustrated because the light turned green and the person wasn't going. And we've all seen that. You go around them and they're sitting on their phone. And that's one thing that people have the misconception of, that, they have a hands-free device, that it's okay to be on their phone, which they can, but it's not the actual hands-on device that's distracting them. It's the thought process. And you can do the research, and the National Highway Traffic Safety Association, and Councilor Kiley knows that as well, is when you have a conversation going in your head, you're processing the conversation. You're not processing the light turning from red to green. You're not processing the people around you. So it's even having that conversation on the phone, and I'm guilty of that as well. And it is what it is. So we just all have to do a better job of letting business go till we get to our next location or stop. So,
Councilor Kiley continually reminds me of that, and that's good. I do have some fun, though, when I pull up next to somebody that I know is that you can tell is texting. They've got it down here, that kind of thing, and I will boom boom honk the horn a little bit and go like this, and they go. First thing they do is,
yeah.
like I can see through the door, but you know what they're doing. Yeah. And I always think that that's a good reminder, because they know that they shouldn't be doing that. I don't do it. I don't text on the phone or when I'm driving. As Councilor Kiley will assert, that I don't do that. I do a lot of other things that he doesn't like, but I don't text. So anyway, are there any other questions or anything? Assistant Chief, thank you very much.
Appreciate it.
You have a good day. With that, seeing no other questions or anything, I'll adjourn this meeting.